Hello, my name is Christine DECARLO, and I'm the Senior Manager of Media and Public Affairs with the American Association of Colleges of Osteopathic Medicine, or AACOM. On July 25th, AACOM launched a new academic recognition program on health equity and health disparities. Through the program, which was designed as a supplemental offering to equip third-year medical students with the skills they need to practice more equitable healthcare upon entering the medical profession, AACOM is helping its member colleges achieve their goal of increasing medical student diversity and ensuring medical education is accessible to all. To celebrate the launch of this important program, AACOM is speaking with 3 osteopathic medical students who provided vital feedback during the pilot phase of this program: Brie Howerton, Ashton Gatewood, and Torhiana Haydel. Brie, Ashton, and Torhiana, thank you for speaking with me today about why third-year osteopathic medical students should complete the academic recognition program. To begin, will you please introduce yourselves?
Hello, my name is Ashton Gatewood, and I am a third-year osteopathic medical student at the Oklahoma State University College of Osteopathic Medicine at the Cherokee Nation campus.
Hi, my name is Brie Howerton, and I'm a fourth-year medical student at AACOM in Florida.
Hi, everyone. My name is Torhiana Haydel, and I'm currently a third-year medical student at Edward Via College of Osteopathic Medicine, the Louisiana campus.
Great. Thank you so much, Torhiana, for joining us today. Our first question is for you and for Ashton. So why is it essential for future doctors of osteopathic medicine to learn about health equity and health disparities?
I believe it is essential for future doctors of osteopathic medicine to learn about health equity and health disparities because we'll see a wide variety of patients. So notably, most countries and counties in the United States are faced with health disparities. And so when you see a wide variety of patients from diverse backgrounds, ethnicities, experiences, you need to be able to provide that same standard of care to everyone despite their socioeconomic status or what's going on in their life beyond medicine.
We know that our patients don't exist in little snow globes or isolated bubbles from the world around them. We have to understand the environment that our patients live in, because what may be perceived as a non-compliance or lack of motivation to engage in their treatment plan, it might actually just be related to the health disparities that they are trying to overcome in their lives. And so I think really understanding the health equity and health disparities that go into how our patients are interpreting their illness or medical condition, and then also what are their ability to access medication, access services, and to act upon the things that you're advising them. And I think Osler said that the good physician treats the disease, but the great physician treats the patient that has the disease. I think in today's complex health world, we almost have to take it a step farther and look at the biopsychosocial environment, because it's gotten so complex to treat these chronic health conditions. I think it's just really essential for future DOs to understand that.
Great. Thank you so much. Our next question is for all 3 of you. What does the osteopathic approach of whole person care mean to you? And does it play a role in how you approach learning about health disparities and health equity?
I think that being an osteopathic physician in training means getting to the root cause of what's wrong with my patient and helping them overcome all of those barriers, not just, oh, there's a problem, I need to fix it. Oh, there's another piece of the puzzle, there it is. I think that health disparities and health equity is another one of those, the secret parts of those puzzles that really help to make the patient better. And so to me, being a good osteopathic physician means taking into consideration all of those things that are not necessarily things that patients want to talk about.
When we look at the body as a unit, we're not merely looking at absence of illness, but also a pursuit of health and well-being, and being able to have the functionality to do everything that that person wants to do in their life. And so we have to consider the health disparities and health equity in that equation. And like Brie was saying, it may be that they want to reach their goal, but there's something maybe they don't know how to talk to you about because you haven't built that rapport up yet. And so I think that this training program helps to complement what we're already taught at our osteopathic programs and will help to build that bridge between where your patient is and your goals for them that you share as their healthcare provider.
The whole person approach is why I decided to go to a DO school, because I love the idea and the tenets of osteopathic medicine that basically outline that the body is composed of mind, body, and spirit, and that healthcare goes beyond just disease itself. I feel that that is essential to patient treatment and longevity within patients' lives, because we're not only looking at, does this patient have a common cold, or does the patient have COVID-19? We're looking at what could have caused this patient to have the common cold. Is it your environment? Is it your transportation? Is it the food you're eating? So it goes beyond looking at just the disease and more about the whole person. And then also, whenever it comes to health equity and disparities, you get to know the neighborhood of the patients you're serving. So you start looking into their socioeconomic statuses. Is the area you're in a place with food deserts or food inequities? Is the place you're in have wide variety of access to transportation, whether it's personal or citywide? So you start looking at all kind of different compounding factors that leads to different healthcare presentations. So making sure to look beyond just one certain thing and that the whole person will give you more information about the patient, where they're coming from, why they might not be as compliant with their treatment plan. And it just helps you be able to navigate with them to come up with the best treatment plan for them, so that they can hopefully get better.
Yeah, thank you for that. That's definitely an important part of care, and certainly osteopathic care. So thank you for highlighting that. So our next question is for the both of you. What advice would you give to third-year osteopathic medical students who are interested in the academic recognition program, but are concerned about balancing it with their other coursework?
For me, I thought that this program was a good balance of, I could start and stop when I wanted to, and it was well encompassing. And so for me, I just made a priority to take 1 or 2 hours every couple of days, and then on the weekends, try to take like a chunk of time to really get through all the material and review what I had learned throughout the week to ensure that I was prepared to take that little quiz at the end. And I think that as long as you have good time management skills, it's a really important thing to prioritize in addition to your schoolwork.
For me, it added to what I was already learning. So we were learning about cardiovascular disease or psychiatry. When you're learning about these topics, the academic recognition program really complements that, because you're learning about some of the social and environmental factors that I think will be another tool that students can have in their toolbox. So when you are putting together your treatment plans, and it's something you can think about that might also set you apart from other students on rounds or even your application to residency. And I think for me, it also allows you to use a little bit of a different part of your brain to think about some of these more public health focused problems. So I felt like I was still studying and working towards some of my school goals, but also it was a little bit of a break to get to do something a little bit different. And that would still help make me feel like I was advancing my knowledge.
And for our final question, this is for also for everybody. What do you hope to achieve with the knowledge you'll gain from this program?
Recognition that each patient comes from maybe a unique background, and understanding what that means to them as far as their perspective of their disease and illness, and what their goals are for health and wellness, and what that means to them. Because I think it's really easy to fall back on kind of that paternalistic medicine and wanting things for your patient, that I think with this program, learning about the special populations, like Brie mentioned with the rural modules, and then also learning about some of the, kind of more public health type factors, I think that that knowledge will really make students better physicians in the long term.
I want to be the best osteopathic physician that I can be. I really liked the rural health module here in this program. I plan to practice in a rural area, and so there are so many more boundaries in that capacity than there are in other places. And so I want to be able to use this knowledge from all of the different aspects. There's 10 modules, there's so many things that we are just starting to put names to, right? Older physicians will say, well, you need to know more about this and you need to look at the whole patient, but we've not labeled those gifts and those barriers until kind of now. And so these programs, I think, are so important to knowing what to do next and how to fully treat your patient so that they can be successful in their own life.
As a upcoming third year who's going to be in the hospitals for the first time, as I meet these new patients who presenting with different presentations of diseases I thought I already knew based on the book work, I'll be able to relay what I've learned through the program to being a better medical student and future physician in the future.
Wonderful. Yes, that is definitely the hope that what you learn through the program can be directly applied to patient care. So thank you for highlighting that. And thank you so much again for speaking with me today. AACOM very much appreciates your work to help evaluate and shape the academic recognition program and your perspective on its importance. We are really looking forward to offering it to third-year students everywhere, and we encourage interested students who are listening to sign up and take the online modules. Thank you so much again.